Dr. Jaffe, what is geographic tongue and how does one take care of it in a natural way?
Well, geographic tongue does exist. What it means is that the papilla, the taste bud, has either atrophied and not been replaced, or some irritant toxin or immunotoxin has caused these papillas to fall away. And then what you can see with your naked eyes, what you can see with your eyes, is patchy, blotchy, red areas known as geographic tongue. And the downstream treatments don't tend to work very well, but if you address this as an immune defense and repair neurohormonal stress response situation, which we do, following our predictive biomarkers to measure epigenetics and lifestyle, and then design a program designed, among other things, among other benefits, to restore the growth of healthy papillas. So it's not an irreversible condition, but it is a very troublesome condition. I fortunately have never had this geographic tongue, but I've had acquaintances, friends, colleagues who have, and they will tell you, please help me now to feel better. And what do we recommend? Well, we start with simple things like the zinc lozenge, which as a lozenge has a lot of benefits in addition to the zinc. Then we check urine pH after rest and adjust the magnesium choline citrate doses accordingly. Then we do a weekly C cleanse and adjust the ascorbate and polyphenolics accordingly. We check the vitamin D level, we check the omega-3 index, we check the 8-oxoguanine, we check the predictive biomarkers. And most of the time, folks respond and get well to this comprehensive approach. And in my experience, when they don't respond within a few months getting better, that means you may still need to continue getting better. When that does not occur, check the stress level of the person, internal stress level of the person, which means checking stress hormones at least in the saliva or the blood, and or toxin exposure in the home environment. And we have a fair amount of experience of how to reduce the bad and increase the good, how to decrease the bad toxin. These are oxidative stressors. These use up your protective antioxidants. These are harmful chemicals, solvents, toxic metals, mold products, radioisotopes, any or all. So I would be proactive about doing what I recommended. And in specific regard to geographic tongue, you have a very interesting endpoint because I predict within 2 to 3 months that it will be substantially better. Within a few weeks, they will begin to feel and function better. But it took years, maybe decades, to acquire this problem. It's going to take more than 20 minutes. It's going to be more a marathon than a sprint to resolve it. I would encourage anyone to follow our example and go by results.